So chapter 9, lifespan development. The standard competencies for this chapter, lifespan development, applies fundamental knowledge of lifespan development to patient assessment and management. Introduction. Human beings evolve throughout their lifespan. AEMTs must be aware of the changes a person undergoes at various stages of life and how that will affect your ability to perform your patient assessment and provide care for the patient. Neonates and infants. So we're going to move through the stages of development. Neonates and infants. Infants age 1 month to 1 year. They develop at a startling rate. At this stage, their method of communication is going to be crying, so different cries will indicate different things. Neonates, a neonate is from birth to 1 month. So ensure that you know that fundamental difference. During the neonate and infant development stage, vital signs, the pulse rate at birth is going to be 90 to 205 beats per minute, and usually at birth, the pulse rate should be over 100. If it's at 100 or below that, then if it's at 100 or below that, you need to be anticipating some type of airway problem, and you need to be prepared to provide positive pressure ventilation for the patient. Within the first hour, the pulse rate will go down from the 200 range to the 120 beats per minute. However, it should never be consistently below 100. Blood pressure directly corresponds to the neonate or infant weight. Their body temperature, the body temperature for the neonate is going to be 98 to 100 degrees Fahrenheit. For the infant, it's 96.8 degrees Fahrenheit to 99.6 degrees Fahrenheit. Weight. Neonate usually weighs 68 pounds, that's 3 to 3.5 kilograms. Their weight doubles by the time they get to 4 or 6 months, and by the time they get to their first year of life, it's going to triple. The cardiovascular system. At birth, neonate makes transition from fetal to independent circulation. For their pulmonary system, neonates are primarily nose breathers. So at birth, they rely more on their nose than mouth for breathing. So if the nose is congested, it can cause complications with their ability to breathe. So primarily, they are nose breathers. They are prone to nasal congestion, can lead to upper respiratory tract infections, and the goal is going to be to ensure that the nasal passage is clear. Their rib cage is less rigid, and the ribs sit horizontally, so they have pliable rib cage. Infants has large tongues and short, narrow airway. So at birth, the tongue of an infant or neonate is large in proportion to the space inside of their mouth. Their ear passage is very narrow, and because of these changes, it put them at risk for airway obstruction. Their epiglottis is also larger in comparison to an adult. all of these changes put them at risk for upper and lower airway complications. For their nervous system, it continues to evolve after birth. Neonate is born with certain reflexes. They have the Moore reflex, palmar grasp, rooting reflex, and sucking reflex. Fontanelles allow the head to be molded, and these are space between the skulls. The skull when the infant or neonate is born. And it's a point that you will observe to determine if the neonate or infant is overhydrated or dehydrated. So if it bulges out, the fontanelle is bulging out, that's a sign of overhydration. If it's sunken or pulling in, that's a sign of dehydration. So fontanelles allow the head to be molded. Depressed fontanelles indicate dehydration. Bulging fontanelles indicate increased pressure or overhydration. For their musculoskeletal system, growth plates aid in lengthening the bones. And that's where we have the epiphyseal plate or line where the bones grow from. Bones grow in thickness by bulging on themselves. For the renal system, infants can become dehydrated easily. So the pediatric population can get dehydration very easily because they have a higher percentage of water in comparison to their body size. So they are prone to water regulation issues. So infants can become dehydrated easily. Kidneys cannot produce concentrated urine. Infants' urine consists mainly of water. Their immune system, they have passive immunities for the first 6 months. So this is immunity that they got from their mother. They receive antibodies via breastfeeding, but that immunity will be lost after 6 months, and then they're going to rely more on adaptive or acquired immunity. Psychosocial changes begin at birth, and it evolves as infants interact with or react with the environment that they're in. Crying is the method of communicating distress. Infants can develop secure attachment or anxious avoidant attachment with caregivers. They can have separation anxiety, trust and mistrust. Infants desire planned, organized routine, gain trust in caregivers, or develop a sense of mistrust. So it's either they're going to trust who is taking care of them or they won't. And it's something that will develop over time based on routine interactions. So that's the neonate and the infant developmental stage. Let's look at toddlers and preschoolers. Toddlers is from age 1 to 3 years of age. At this stage, the pulse is going to be 80 to 140 beats per minute. The respiratory rate is going to be 22 to 37 breaths per minute. Systolic blood pressure is going to be 86 to 106 millimeters of mercury. Temperature is 96.8 degrees Fahrenheit to 99.6 degrees Fahrenheit. And for the preschooler, it is 3 to 6 years. During this stage, the pulse is going to be 65 to 120 beats per minute. Respiratory rate is 20 to 28. Systolic blood pressure is 89 to 112. During this stage, there's a loss of passive immunity. And as I stated previously, this would be the immunity that they receive from their mothers breastfeeding. At this stage, they're going to rely more on acquired or adaptive immunity. There is neuromuscular development or growth. The renal system starts to develop. They can learn toilet training at this point, and the teething process occurs. Psychosocial changes. They learn to speak and express themselves. They master basic language. They interact and play games with other children. They begin to understand cause and effect, and they learn to recognize sexual differences. At this stage, again, they still, majority of their body percentage is water, and it's higher in comparison to an adult. They are top heavy, so they can have issues with their balance, and if they fall, they're gonna fall head first. They're still not at a stage where their airway cannot be easily compromised, so they're still at a high risk of airway compromise. School age children. Now, the school age developmental age is from age 6 to 12 years. During this stage of development, the vital signs get close to what you would see for your adult patient. The pulse is 58 to 118 beats per minute. Respiration is 18 to 25 breaths per minute. The systolic blood pressure is 97 to 120 millimeters of mercury. They grow at about 4 pounds or 2 kilograms and 2.5 inches or 6 centimeters each year. Their brain activity increase in both hemispheres, and they can become dominant in one. So persons that are dominant in the left hemisphere, meaning they are left brain dominant, they tend to excel at academics, English, maths. They're very good at academic stuff. Persons that are right brain dominant, they will excel more at skills, hands-on stuff. They excel more when they use their hands or do things with their body. That's your right brain and your left brain dominant. And there are persons that have both. They're dominant in both. They're good at academics and they're good at hands-on stuff. During this stage of development, the permanent teeth come in. Psychosocial changes. It's a critical time where children learn reasoning. They have pre-conventional reasoning, conventional reasoning, and post-conventional reasoning. They begin to develop self-concept and self-esteem. Now, the adolescent stage of development, this is age 12 to 18. Vital signs start to level off to the adult range. The pulse is 50 to 100 beats per minute. The respiratory rate is 12 to 20 breaths per minute. The systolic blood pressure is 110 to 131 millimeters of mercury. There is a rapid 2 to 3 year growth spurt. Girls finish growing at 16 years of age. For the boys, it's going to be at 18 years of age. The reproductive system matures. There's secondary sexual development. Menstruation begins in the females or girls, and the boys are able to produce sperm at this stage. Continuing with psychosocial changes, adolescents and their families often deal with conflict. There are issues with privacy, self-consciousness increases, They may struggle at this stage to create their own identity. They're easily influenced by peers, and they start to experiment with things that they shouldn't, specifically drugs. So there is peer pressure. So peer pressure is a major factor. Antisocial behavior peaks in 8th to 9th grade. There is greater interest in sexual relation, and their code of personal ethics will develop at this stage, and it's going to be based on what they are accustomed to, based on the environment that they grow up in and who they interact with, and what type of values their parents instill in them. Now, the early adult stage of development. This is age 19 to 40 years. Vital signs, the pulse rate is around 70 beats per minute. The respiratory rate is 12 to 20 breaths per minute. The systolic blood pressure is 90 to 140 millimeters of mercury. From 19 to 25 years of age, the body should be functioning at its optimal level. Lifelong habits and routines develop during this stage of development. Wear and tear on bones and changes in body tissues and muscles will start to occur. Psychosocial changes, their life centers around work, family, and stress. They strive to create a place for themselves and settle down. Marriage and childbirth are common during this stage of development, and it's one of the most or more stable periods of life. Now, the middle adult stage of development. This is age 41 to 60 years of age. Vital signs are the same as early adults. The body is still functioning at a high level. They are vulnerable to issues with their vision and hearing loss. And it is recommended that at age 40, a medical is done every year. Below age 40, every 2 years. The cardiovascular health becomes an issue. Middle adults. Cancer incidence increases, so they are at risk for cancers developing. They may show symptoms of diabetes or hypertension. Menopause will occur in the females, and it occurs in the late 40s or early 50s. Exercise and a healthy diet can diminish the effects of aging. Psychosocial changes. There's a focus on achieving life goals. They readjust lifestyle as children leave the home, generally have a physical, emotional, or spiritual reserves to handle life's issues. They may be caring for children leaving for college and aging parents as well. Now, leading cause of death. Unintentional injuries would be linked to your toddlers, preschoolers, school-age children, adolescents, early adults, ages 40 to 44. Between 45 and 60, it's cancer. Above 60, specifically 65 and older, it's heart disease and cancer. Older adults. The older adult age group is age 61 or older, and the life expectancy is changing constantly. approximately 78. Persons are living beyond that now because persons are more health conscious and they are taking better care of their bodies as they get older. It depends on many factors: year of birth, country where the person lives, and of course, definitely where the person lives is going to be a huge factor. So if it's a country where the percentage of poor is less than the percentage of persons who can afford a good living, then the life expectancy is going to be better if they're eating healthy and taking care of their body. If it's a country where the percentage of poor persons are higher than the middle class and upper class, then naturally the life expectancy is going to be short, because if a person is poor or coming from a poor family, they can't afford to eat healthy, they can't afford good health care, they can take care of their body appropriately, and this will put them at risk for all type of health conditions that can lead to death. And they sometimes have health conditions that they cannot afford to go to the doctor and get the health condition control, or maybe they went to the doctor and they were given prescriptions, but they can't afford to fill the prescriptions. The vital signs at this stage depend on their overall health, whether or not they have medical issues, the type of medication that they're taking, if they're on medication. Often overcome numerous medical problems, and they may need numerous medications. So the geriatric population, if they have medical issues, they usually are placed on multiple medications, which as an AEMT, you have to spend time and cipher through these medications and pay attention to the class that these medications fall in, because the class of the medication is going to give you a good idea of the type of effect or the mechanism of action that that medication will have on the body. And pay attention to medication interactions. For the cardiovascular system, it declines with age, largely due to atherosclerosis. The heart rate and cardiac output decrease. The vascular system becomes very stiff. The ability to produce replacement blood cell declines, as does blood volume. And when cells are not able to reproduce cells properly, that's where we start to get abnormal cell forming, and that will lead to cancerous cells and cancerous tissue forming. For the respiratory system, the size of the airway increases as smooth muscle weakens and the surface area of the alveoli decreases. So this is going to affect their upper airway and lower airway. As the surface of the alveoli decreases, it put the patients at risk, put these patients at risk for developing infections in the lungs. The natural elasticity of the lungs decreases. The changes are often gradual, so it's not sudden changes. These are changes that will occur over time, but they can be accelerated if the patient is not taking care of themselves. So if they're not healthy, if they have issues with malnutrition, then these changes can be accelerated. Loss of mechanisms that protect the airway. There is muscle weakening, which can lead to airway collapse. Vital capacity decreases, their residual volume increases. And if they're having an increase in residual volume, it can put at risk for retaining too much CO2. For their endocrine system, people tend to slow down physical activity by not decrease their food intake. So they don't work out much anymore, and their food intake has not changed, and this can put them at risk for developing endocrine issues. Insulin production drops off, their metabolism slows down. Changes in mental status may be the result of blood glucose level changes, reproductive system changes to some extent. For renal and gastrointestinal system, filtration function declines. And filtration is a very important process in the body. If the body can't filter out waste, then the waste is going to remain in the body, and that can cause significant issues with the kidneys and the heart. Kidney mass decreases, the ability to clear waste from the body and conserve fluid decreases. Changes in gastric and intestinal function may inhibit nutritional intake and utilization. The taste bud sensitivity decreases, teeth become weaker, saliva secretion decreases, gastric motility slows, gastric acid secretion diminishes, gallstones become increasingly common, and that is expected. So if the process of digestion is not at its optimum level or functioning effectively, then we'll get undigested products, and that's basically what gallstones is, but it doesn't completely break down the digestive products, and it crystallizes. The anal sphincter changes and reduce elasticity. For the nervous system, the brain weight decreases, so most of the tissues start to go through atrophy, which is a decrease in size. And if there's a decrease in size, then there is going to be a decrease in function. So the motor and sensory neural networks become slower and less responsive. Diminished number of brain cells, loss of neurons, but not knowledge or skill. Sleep pattern change. The nervous system continued. Age-related shrinkage creates a void between the brain and the outermost layer of the meninges. So because of that atrophy that's occurring, there is a gap between the brain tissue and the skull, which that creates a space that allows for more shifting. So if they fall and hit their head, it's easy for blood vessels to tear, and they start to get hemorrhaging on the brain, depending on whichever layer of the meninges is affected. The peripheral nerve sensation is diminished, and it is misinterpreted. Sensory changes. Most older adults can see and hear well. Some may need eyeglasses or hearing aids. Pupillary reaction and ocular movement become more restricted. Hearing loss is 4 times more common than vision loss. Psychosocial changes. Increasing number of older adults in the US has produced a need for more assisted living facilities. So as technology improves, as people become more health conscious, they tend to be living much longer. So there's a higher need for healthcare facilities or healthcare personnel or living facilities for these persons. But everything comes at a price. So persons who can afford it will get access to these type of resources. Persons who cannot, i.e. the poorer population, will not benefit in any way from this. Psychosocial changes continued. We need to remind older adults of their self-worth. In 5 years preceding death, mental function is presumed to decline. Older adults face issues of mortality. And these are we have come to the end of the chapter, and that's the developmental stages from neonate to older adults. And I would suggest to you to pay close attention to the differences or changes in the pediatric and, of course, geriatric. These are the ages of development where you're going to have changes that are present, or developments that are present that can affect the patient as it relates to traumatic injuries and medical emergencies. And that would be the end